Hey everybody, in this video we're going to discuss how to treat a knee. This is a common orthopedic condition, whether it's acute or chronic, or regardless of what ligament or soft tissue is involved. Knees are a big chunk of the orthopedic population that most outpatient clinics are seeing. So it's really important to understand the basics of dosing and what you're trying to address with the laser when you're treating the knee. So the target tissue in most cases when you have an inflamed, acutely swollen knee is the synovium. You're trying to address that soft tissue, which is going to impact the inflammation in the joint space itself. So in order to cover the synovium, you want to try to do your best to treat all the way around the knee in a pattern, just visualizing where that soft tissue resides and going all the way and trying to cover as much of that tissue as possible. You also don't want to neglect the distal bursa on the distal aspect of the quadricep. That's also an important soft tissue that often has inflammation involved with it in the knee. For a chronic knee that isn't swollen, you're still trying to address the synovium primarily, except in that case, you're going to try to treat it with higher dose and higher power in most cases, because you're going to try to create analgesic effects and bring pain down quickly. And we'll differentiate those two things here in just a second. So, when you're trying to treat, if you have your perfect protocol, the first box, as you know, is to calculate the area you're going to treat. So your claw grip is roughly 100 centimeters squared. You're going to map out around the joint how much area you're going to treat. For most knees, that's going to be 1, 2, 3, 4, and then this distal quad is going to be roughly 500 centimeters squared of area. So if you were on your device, you would come to your perfect protocol, and in the first box you'd put 500 in for your area. Under power, you have some different options. We recommend for acute inflammation that you be a little more conservative on that first treatment. You may be around that 10 watt range if you had a 15 watt unit like this. If you had a 25 watt unit, you probably are going to still be in that 10 to 15 watt range to start. What you're trying to do is avoid any type of increased rebound type pain complaint. And sometimes when you use higher irradiance via higher power, you increase the chance that they might have some rebound pain. So you want to get a feel for how that patient's going to respond after a treatment or two before you start to get more aggressive with your power settings and dosing for that matter. So we're going to say, in this case, the knee was acutely swollen. And to address that, the literature shows that roughly 6 to 8 joules per centimeter squared is where you want to be for the dosing for that. So we're going to set it at 6. Underneath, this is the power setting. We're going to set the power at 10. You just hit delete at 10 watts. And then for dose, we're going to hit 6 joules per centimeter squared and hit calculate. What the screen is going to show you is that this treatment is going to take 5 minutes at 10 watts, and you're going to deliver a total of 3,000 joules to that knee. So once you're ready, you'll put on your protective glasses. As the patient will have on the same, you're going to hit the standby button, which is then going to bring the laser up into a ready state. You're going to have a variety of heads that you can choose from. We recommend generally when you're going over the bony prominences around the knee, that the large cone is a good choice. Some people really like to use the massage ball, especially in the posterior aspect of the knee when treating those soft tissues, the bursa that lay back there. That sometimes can be beneficial when you're trying to do some soft tissue work as well. But sometimes patients that are, especially if they're in more acute levels of pain, they don't like that to be rolled over the bony prominences of the knee, and they might not tolerate that quite as well. But it's certainly up to your choice on which one would be a better head to choose from. In this case, we're going to use the large cone. And what you're going to try to do is when you're treating that is just distribute that energy equally around that capsule. You're going across hatch fashion, almost as if you were trying to paint that tissue with a spray can. You may, when getting to the back of the knee, have to change position. You may even have to have the patient move their leg a little bit so that you can get access to that posterior aspect of the knee as well. Just use your clinical judgment. How's that feeling? Feeling great. You want to make sure you're checking in with your patient every 10-15 seconds to make sure the temperature is okay of the laser. While you're treating, important not to stop that motion and keep that moving at a nice constant pace. as you're going around the joint. We recommend stopping roughly every minute and a half, 2 minutes, checking in with your patient and asking them what their pain level is. How's it feeling? Are things improving? Often they might start to tell you, hey, it was hurting in the front and now it's just sort of hurting in this one area. It allows you as the treater to sort of zero in on that spot and see if you can maybe get that pain to come down even further. The other part of the treatment, if you can, it's a little hard with our setup here, is that while you're treating, try to get some passive or active motion while you treat. So if she could get a little bit of flexion and extension while I was treating her knee, just to incorporate some motion, get some synovial fluid moving, exposing different aspects of the joint capsule, those are all benefits to the treatment. It's easier to do with certain joints than others, but for the knee, it's usually pretty easy if they're on the table and you get them to slide. The key is that you don't want it to be painful though. We're trying to bring pain down, so it should just be a very pain-free motion, whether it's passive or active. So that's for your acute patient, 6 to 8 joules per centimeter squared. Power is going to be somewhere in the 6 to 10 watt range when using our equipment. For more chronic pain, you're still going to try to address the same synovium. You're probably going to do the exact same calculation if you have a chronic arthritic type knee, but you're going to try to use higher power in that case. The higher power is going to help reduce pain quickly and might free up motion better. Just has a different impact on the nerves that are around that knee. So not uncommon to go up towards 20, sometimes even 25 watts to get maximal analgesic effects. I would recommend to start on that slightly lower side, around 20 watts of power, and then build after the first couple treatments once you sort of see how the patient responds to that. Again, you're going to try to treat circumferentially around the knee and get your best outcome. In cases where you have a very specific pathology like patellar tendonitis or maybe a bicep tendon issue and you know that the area is quite a bit smaller, you would just adjust your calculation. So in this case, we're trying to treat all the way around the knee, so that's where our number of 500 centimeters squared comes in because we're trying to address the synovium. But if I was just trying to address the patellar tendon, and if this was 100 centimeters squared, that area would be quite a bit smaller. It might be, 1/3 of that. So your area would be smaller, treatment time is going to go way down. So don't be afraid if you really are treating something specific to just try to really zero in on that tissue and treat that locally and see what the response is before you start to treat other areas. The last treatment tip I'd give you is that when treating in an acute setting where you have swelling that's present in the knee, you're going to be, like we said, in that 6 to 8 joules per centimeter square range. To get pain relief if they were having acute pain, you're not going to want to go a lot hotter or higher with your power due to the possibility of increasing the chance of rebound pain. But if you really wanted to try to increase some analgesic effects, you could come proximally on the leg and treat the femoral nerve in the area of the inguinal ligament, right before it branches out into those different branches in the femur, into the quad. So you could treat that area at a much higher dose, somewhere in the ballpark of 15 joules per centimeter squared, and using your higher power that you have available to maximize that nerve response, reducing conduction velocity and reducing the compound action potential that's coming back from that afferent. And the result might be that the pain from the person's knee comes way down. So if you're in a scenario where you don't want to overdose the joint itself, but still get some analgesic effects, you can do that both in the sciatic tract as well as the femoral nerve more proximal to the knee, and that tends to work really well. It also isn't a bad idea to treat the nerve roots that are involved. So if you went to the low back from L2 to L5 and treated that ipsilateral side at 15 joules per centimeter squared at high power, the highest that your machine had, you're going to maximize the benefit there by treating the dorsal root ganglia where the cell body resides for those afferents. So hopefully that helps. Again, by way of review, try to treat circumferentially if you have a swollen joint. Try to get some active motion with the treatment as you can. Off contact heads tend to work really nicely on the front of the knee. If you're going to use the massage ball, that usually works best in the soft tissues behind the knee. But hopefully applying a few of these things, you're going to get better outcomes with your knees, and good luck.